Good morning, it's your Rabid Raccoon. I'm doing splendiferous today. Yes, my little gallstones, or big ones, who knows, are floating. You see, if you don't know anything about gallstones, oh, I got something in my freaking eye here. If you don't know anything about gallstones or kidney stones, when they're floating, you're okay. When they're hitting the lining, that's when you get the pain. So I'm trying not to shake them up too much. Yesterday, uh, I don't know if I talked about Mickey Pickles, but um, we got him uh, some supplements to calm his ass down because he's obsessively licking his paws. Well, he was obsessively licking his bed, and Sherlock, I am now demoted to Watson, but Watson is cool too. Watson's a doctor. So Sherlock is now Paul, and he discovered that he deduced that Mickey, from licking his bed so much and then sticking his little face into the moist bed, probably contracted some sort of infection from his face being nuzzled into that wetness and then the wetness getting into his wrinkles. So, and then some dogs will lick their paws, so he might have an infection in his paws. Even though I'm looking at his paws, I don't see anything. Dogs can actually get a yeast infection from their paws, or on their paws, excuse me. And of course, in their nose folds and in their ears. So if you didn't know that, that's quite interesting. So, today his wrinkles are really red. In the folds, there's a little bit of blood. I keep cleaning them out, not like consistently all the time because I like to let them relax. I did get some dog liquid bandage and it's got an anti-itch in it, but he's still digging at them. And it has something in it that makes him supposedly not want to lick as much. He is one stubborn SOB because he still licks at it. But so I gave him his joint supplement because he limps around. He's getting old like me. And then his hear him snoring, his anti-anxiety med, and I cleaned out his poor little wrinkles and did a wash on him, and then put some liquid bandage on. So I'll let him rest because I don't want to agitate the skin. I'll let him rest on that until tonight when my husband gets home, and then we'll clean him again. So that's the Mickey Pickles update. Uh, I got some new merchandise yesterday. I was feeling really good yesterday too. The gallstones are floating around, dancing, relaxing, no hitting the walls, so I'm happy about that. And we went out, dropped a couple things off at Savers. If you don't know what Savers is, it's like it's like oh shit, Goodwill or Salvation Army type place. The profits that they make there go to the veterans, so it's pretty cool. And we like to go in there because some stuff still actually has the tags on it, and Cameron loves ties, so we buy ties there and button down plaid shirts for him because he likes plaid. Um, 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 um. Cold weather is coming. It's nice. It's been 60-degree weather in the mornings and 60-degree weather at night, and it's nice sleeping with the window open instead of having the fake air coming from the air conditioners. I am grateful for air conditioners, but I prefer natural air, just like probably everybody else does. Um, I I've been thinking about something. Uh, I had therapy yesterday, and I was talking with my therapist about um, emotions, and sometimes emotions are a foreign concept to me. Um, I've been, oh, excuse me, I've been mentally ill for so long that it's hard sometimes for me to understand emotions. Um, I do a lot of people watching and taking mental notes that get lost in my head. And sometimes I wonder if I should be feeling more than what I feel. Because as I was talking yesterday, I said to my therapist, and I've been writing this in my journal, there's some things that have been happening where I feel like I should be more upset than I am. And I wonder, if the meds that I'm on are keeping me from feeling this way. So I'm thinking that I'm telling my therapist this, and she's saying, and I'm thinking it anyway, that it may be time for a tweaking in my meds. So it may be time to go lower in dosage, which is great. But the thing is that one of the drugs I'm on is called Effexor, and this drug is so massive that um, it takes a long time to go off of, and you have to wean off it really slowly. Because going off of it, being weaned off of it, is like being taken off of a really massive narcotic. It's like, okay, there was a week that there was a mistake in my scripts, and I went a week without my Effexor due to no fault of my own. There was a problem between the psychiatrist's script that he wrote and the pharmacy. There's something, and the insurance company too. There was something wrong, and I went a week without my Effexor. Well, it was hell, hell, hell. I felt like I was crawling out of my skin. I had the shakes. I was crying. If I mean, I don't know what PTSD feels like, but I felt like I was dying. I was in tears. Tear, brr, 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 brr. I didn't know what was happening to me, and I couldn't even talk on the phone. I couldn't function. I couldn't function. My husband actually had to talk to the insurance company and the doctor and stuff, and I'm screaming in the background, I need my meds, right in the middle of Aldi. It was crazy. So when the new doctor, it was weird, when the new doctor came in to replace this psychiatrist, he ended up retiring. Huh, funny how that happened right after this episode. And I wasn't mad at him. It was something to do with the way he wrote the script, and the insurance company didn't like it. Damn insurance companies. So, that scared me. So when I brought it up with the new psychiatrist, who happened to be a nurse practitioner, and I have no problems with doctor, nurse practitioner, or physician's assistants. I don't care. Sometimes the nurse practitioners and the physician's assistants are better than the doctors are. And when I discussed this with her, this problem that we had, that's when she explained to me about Effexor and how hard it is to wean off of that and how it takes forever. Now, this has been a miracle drug for me. That plus the Lamictal together has been the only concoction that has worked perfectly for me with my bipolar disorder. So, when I started discussing with her about wanting to go down in my meds, we started tapping away at the Lamictal, and that's been successful so far. So I guess when I talk to the new nurse practitioner that's replacing this nurse practitioner, which is why I'm going to be switching practices, but the new place that I'm going, Buffalo Medical Group, or is it Dent Neurologic? Not sure. Doesn't matter. They don't take new patients until January, so I'm going to keep going to Community Concerns in Hamburg, New York, until this place opens. And the reason why I'm dropping these names is in case you live in my area and you're looking for places to go. That's the only reason I mention them. So, what was I saying? So I guess I'll keep chipping away at the Lamictal, but I don't think I could ever fully go off Lamictal. When I first started with this nurse practitioner, she was the only one that ever said that I was over the amount of Lamictal, and she had been working with people, men that were 3 times my weight and size. So she's like, "Why are you on so much of this?" I don't know. That's what they put me on. So she slowly weaned me down to a normal dosage of it, and I felt great. But now it's getting to the point where I feel like Data from Star Trek, where before he started having any emotions, I feel just like him a lot of the time. There are things that I know that normally I would have a couple of years ago, I would have felt really angry and rightfully so about that I'm not getting pissed off at all about. And I sit there going, shouldn't I be more upset over this? Or other things, shouldn't I be more happy about this? Shouldn't I be, and I'm questioning my emotions. And I think it's the meds, and it's a fine line with someone with mental illness because you don't want to go too far one way or the other. You want a nice, healthy balance. Because if you go too far one way or the other, then you're not functioning properly and your illness is coming out. And then you got to fuck with your meds again. So, there's people have no idea when you don't have a serious mental illness, you really don't have an idea about what someone with mental illness is going through. So it's hard when that stigma is out there, like, oh God, or people make those off comments. Did you take your meds today? Really? I tend to be able to joke about it more than some people do, but sometimes it really hurts. For me, what hurts is when people make comments about how many pills I take. And they don't, it's like, I don't just take pills for mental illness. In fact, I only take 2 pills for mental illness. I'm also taking pills for my FM, my migraines, and I take a lot of supplements. Don't ask me what I'm taking my pills for. Just make a comment on how many pills I'm taking, you fucktards. You know what I'm saying? It makes me sick when people judge that. And I know there's a lot of you out there that feel exactly the same way. And until you say something, it's going to keep happening. You know, I've said to people, do you actually know if these are all meds? Are you me? You know, I've had people look in my medicine cabinet. What are you doing looking in my medicine cabinet? I look in people's medicine cabinets too, if I'm really, really bored. I also like to look and see what people use for shampoo on the edges of their tubs. So if you invite me over and I'm in the bathroom for a long period of time, I will read the bottles of shampoo that are on the edge of your tub. I probably won't go through your medicine cabinet though. Um yeah, I tend to want to um I tend to want to try to feel more human now than I used to. Um, in the past, it's like, screw these emotions. I don't want to feel anything. And sometimes from time to time, I do go through that. But most of the time now, it's like I want to feel more things because I see people around me feeling things. And I see the joy they get out of it or the cleansing they get out of the sadness. And then how good they feel after they've had an angry spell. And I feel like I'm missing out. You know, I sit here and I watch them and go, wow, I think that I need that. And then I don't have it. And I feel lacking. You know? It's weird. Because when I've had manic episodes, at the time, it's great. It's energy and it's all over the place and it just feels so great. And I'm not, you know, and it's a high and it's speed without taking anything. You know, it's without the drugs, without, you know, without anything added to it. It's just this natural kick of adrenaline and I get really giggly and high and laughing and just I spend a lot of money, but and I get a little dangerous and I do crazy stuff, but I feel invincible. And if I could just harness just a little bit of that safely and pull that into my life, that's what I want. But I can't let myself get to the manic point because that's just dangerous, you know, and I want to feel the proper emotions that I should feel when I'm sad, but not get to the depressive state. See what I'm saying? The medicines are supposed to keep you in that even zone. But right now I feel like the even zone is closing in and in and in to the point where the walls for the even zones are closing in and I don't like it. So it's time to talk about meds. So it's okay. If you're on meds and you feel like they're working too well, you can always talk to your doctors about changing things up. Because like I've said before, as you age, and like if you're young and you're taking meds and then you hit puberty, or if you've been a teenager and then you hit your 20s and 30s, metabolism and everything changes. So of course your the way your body digests and distributes your meds is going to change. Everything changes. So my body may not need as much Lamictal or as much Effexor as it did need. Um, I'm getting older. I'm 45. So when I was 40, I may have needed this dosage that I'm on. And now I may be able to go down even more, which like I said the other day, is always the goal for me, is to go less and less and less. I know I will never be able to be off the meds. I wish I could, but I know, I just know that I can't. And sometimes that's a hard pill to swallow. Eh! But think of the other side of it. How destructive and dangerous mania is, and how dangerous and scary depression can be. I'd rather take the pills than risk that. So, that's my thought for right now. And if you're having problems, don't be afraid to get help. Things are a lot different than what you see in movies. And in fact, in my therapist's often office, there is no little couch thing that you lay on. They've always had little love seats or chairs. And most visits to a therapist's office usually last about 30 to 45 minutes. So, I've met no Sigmund Freuds. All right, guys, that was my topic for now. Was about meds and even keels, and you know, dealing with change in your feelings, and yeah, give an update on Mickey Pickles. Hopefully, I can get him into the vet for Monday. So what's going on with him isn't super serious, but enough where he does need to go to the vet. And he's due for those shots anyway, so get everything done at once. All right. Well, I'm closing this out now, and I may be back later, but gonna try to stay on. I'm gonna try to deal with some topics. So if you have any topics you want me to discuss, please let me know either on here or on IG, or email me at rabidraccoon70 rabidraccoon73 at yahoo.com, or get me on Instagram, scrambled eggs and brains, or just drop me a note right here on my vlog down below. Thank you and have a nice day. Bye now.